Thank you. Good evening and welcome. Glad you guys could be here tonight to talk about something that's going to be really important to you, is how your care plan is going to unfold for you. One of the things that we found over the years was people would get confused about what's next for them. So that's really what this health talk is about, what to expect next for you. In order to have any discussion about chiropractic, though, we have to talk about the why, because I think the why behind anything is the most important thing. If we have a big enough why behind anything we do, it makes doing that thing easier, right? Does that make sense to you? Okay, good. So in chiropractic, the why is a discussion we have to have a little bit about anatomy, unfortunately, and physiology, function of our body. So we'll do that quickly, and then we'll talk about the details of the things that we need to focus on tonight. So the why behind chiropractic is really about control of the central nervous system, right? So what are the three major parts of the central nervous system? They are what?
Spine.
Spine.
Brain. And spinal cord.
Yep. Brain. And what else?
What did I miss?
Anybody else want to guess the other part?
The brain's the top of it.
That's right, which are the nerves. So you guys did good. That was awesome. So we have the brain that sits at the top. Right? We have the extension of the brain, which is the spinal cord that runs down the center of the bones in our back. And then we have the branches off of that, which are the nerves. So the way that this system works is that the brain will originate a message. It'll send it down the nerve pathways in the spinal cord out into the body. Now, we said that the central nervous system controls what in our body? What does it control? Pardon me?
Everything.
Everything. Absolutely right. Everything in our body is controlled by the central nervous system. So this nerve impulse could go to any tissue we want to name, right? Let's say it's the kidney. So the kidney is receiving the information from the brain, right? Kidney is able to communicate back into the brain in the same manner. And then we have this loop of information that's happening, right? Between the brain cells and the tissue cells of our body. And we said that could be anything. So this constant outflow and inflow of information, this is what makes us work. This is how we're healthy too, by the way, when this works at the highest level, right?
Mm-hmm. So
we know from our understanding that this tissue is extremely delicate, isn't it? And you guys have seen examples of people who have damaged that tissue with very disastrous results in function of their body, right? So the Creator said that this tissue has to be protected, and it created a solid surrounding of bone for our brain, which of course is our skull. But then we have this extension of the brain, which is called the spinal cord, which is equally as delicate. That has to be protected too. Now, ideally, it would be great if we could have one solid tube of bone like we had for the brain, right? But that wouldn't give us mobility, would it? We'd be very, very rigid. So what we have gained in flexibility by having 24 separate bones, we have given up some degree of stability. Does that make sense to you? Mm-hmm. So we know that the vertebrae stack around the spinal cord, and then in between these vertebrae are where the nerve roots exit. You guys have all seen this before because we've talked about this in your review of your findings. So clearly, when we have these vertebrae that are in the right alignment and the openings are wide enough, we have good communication, we're healthy, and we're functional, right? We're working the way we're supposed to. But we have this other thing that happens, right? The flexibility we have can cause our spine to shift from its normal alignment. And we call that what? What's the word we use for that? Subluxation, right? So we can have subluxation of these vertebrae. They shift from their alignment, and now they've irritated that nerve root, right? So I want you to take a look at something. Each of you is going to get to hold one of these, because this is going to be important for your understanding. May I give you one? For you, and one for Ray. One for you, sir. And last but not least. So this is what?
Dime.
It's a dime. Is it very heavy?
No.
Not very heavy, right? So for years, the medical profession said of chiropractic, you have no validity. There's no proof that subluxation even exists let alone it can cause sickness and disease in the body. There's no way that these vertebrae moving out of alignment can cause compression of the nerves and cause people to be sick. And we didn't. There was no research that said that that was true. What we had was a lot of anecdotal evidence. And what I mean by that is, Renee has headaches, she comes and she gets adjusted, right? And Renee's headaches go away. So Renee's excited that she's feeling better, so she tells Kathleen, hey, I used to have these headaches, but they don't bother you anymore. And Kathleen's saying, well, I've got back pain, so I'll go. So she comes to the chiropractor, she gets adjusted, she improves. And that's how with chiropractic, it's how it still spreads, by the way. But that's how it started, right? With this anecdotal evidence. Well, I've had this care and therefore I'm better, but there was no research that said this is what's happening. Well, the answer to that question came from medicine, believe it or not. In 1996 at the University of Colorado, Dr. Su is a researcher. And what he found was the weight of this thing right here, the weight of this dime, that is placed on the spinal nerve root will decrease the function through that nerve root by 60%.
Really?
60%. So 60% reduction in nerve system energy from that. That's not very much. And he said that reduction would happen within 5 minutes. It's very impactful on us, right? So I have to ask you, if throughout your entire lifespan, from the day you were born until the day you die, you only have 5 minutes of nerve compression in that entire span of time, would that really impact how healthy you are as a human being? Not really. Now I want you to think about something for a minute, because this is really important for you to understand. If that nerve compression stays there for 5 days, would that have more impact?
Yeah.
Yes. So how about 5 months? Or 5 years? You know what we see in chiropractic? About 20 years. About 20 years of that compression. So I have to ask you, whatever is at the end of this nerve, how well is that going to function? Only receiving 40% of the information it needs to work the way that it's supposed to. Not very well. So what happens over time is we have something called dysfunction. Now what that means is, it's not working right, but guess what? You don't feel it. You don't even know it's there. That dysfunction, if it stays there over long enough periods of time, leads to a lack of state of balance in the human body, which is called dis-ease. And if this ease stays there long enough, it will become a word you guys know very, very well, which is disease. So this breakdown process takes years to get to this point. Now here's the challenge we have with our culture. Our culture tells us if we don't have a symptom, then we're what?
Wow.
We're healthy. We're fine. There's nothing wrong with
Feel
us.
fine, yeah.
Researchers will tell us that this process of disease breakdown takes years to get to that point. And we may not have any signs or symptoms of that until we get to this point. Researchers have shown that one of the last things to show up in the process of breakdown are signs of disease or symptoms, right? And one of the first things to improve when we start care are symptoms. So that being the case, they're not reliable indicators of truly how healthy we are. Now, our culture spends a tremendous amount of money right here. So about $1.7 trillion, I think, is where we are right now in healthcare per year, right? Trying to do what? Put a name on that,
Yeah.
right? And then developing some sort of treatment plan to treat that. Does that make sense to you?
Sure.
It should, because that's what you experience every time you go to the doctor, right? So you sit down with your doctor and they ask you, oh, hey, John, how does that feel? And when did that start? And what have you done for it? And let's do an exam, or let's get some x-rays, let's have an MRI, let's do a CAT scan, let's do whatever test we can do. All of that is to call that something, to give it a diagnosis and a
Right.
name, and then everything that comes after that is to treat that. The challenge we have with that, and the challenge we have with this process of subluxation is if we can treat the symptoms and reduce the symptoms, right, suppress the symptom reaction in the body, then somehow we've deluded ourselves into believing that that has made us healthy. All that's done is cause this to be less noticeable. It hasn't really fixed it. You know, it's like driving down the road and your indicator light goes on in your car, that your oil pressure is bad, or your oils, you need to have an oil change or something like that. And that just annoys the heck out of you, so you take a piece of black tape and you stick it over top of that oil indicator light. I mean, suppressing symptoms is no different than that. Or the smoke alarm is going off and we just go out and take the batteries out of it. You know, instead of really addressing what the underlying problem is, we've been deluded into believing that if we spend money and we do everything here, we're going to be just fine. Now, the challenge we have with chiropractic care is that some of you have been in this disease process so long that you're not going to be able to come back up this pathway. You're going to get stuck with some of the signs and symptoms that are left of this. Some of you are going to be able to come back up this pathway and get back to normal function in your body. Here's the blessing of the work that we do compared to other chiropractic offices, is we're working on structural rehabilitation, correction of your spine. So these areas where you have subluxation that are not producing symptoms for you yet are going to heal before they ever get to the symptom stage. That's the blessing of the type of work that we do here. So everything that we do is to help you to reduce subluxation so that your body works the way that it's intended to work. Here's the kicker of this thing, guys. I don't know how to heal you. I have no idea how to heal you. I have no idea how we end up having an adjustment that sets that vertebra into motion that allows your innate intelligence to heal yourself. But that's what happens. I don't heal you. You heal yourself. So everything we're going to talk about from this point on is how do we do this effectively, right? How do we reduce these subluxations effectively so that they're really going to help us to not only feel better today, but be healthy tomorrow. That, for me, as I see it, is a fix for the problems that we're focusing on here. Not just, oh, hey, I don't have that pain anymore because I took, 1,600 milligrams of ibuprofen. Okay. All right, but now I don't have that pain anymore because I've restored the joint function to where it needs to be. I've corrected posture so when I stand in the gravitational field and gravity compresses down on me, it's evenly dispersed through my skeleton. So I'm not compressing the nerves, I'm not compressing the disc, I'm not compressing the soft tissues. That to me seems like a fix for the challenges that we deal with as human beings, right? It does to me. So how do we get there? How many of you remember the first test we ever did with you? When you first walked through the door, what was the first test we did for you? After we said hello, we did something. Remember what it was?
Your
Posture.
posture.
Yes, you guys are good. Nobody can ever answer that question. It's amazing for me. We stood you up in front of the mirror and we checked your posture. Now, the reason we check posture is because the posture tells us about a sick spine. This leads to a sick spine. This leads to a sick spine. This leads to a sick spine, right? So we use that as the baseline indicator of what your main subluxation patterns are. It helps us to identify that you have subluxation in the first place. And then after we did the rest of your assessment, we sat you down, we looked at your x-rays, we had discussion about that. We brought you out on this table and you guys said, yeah, I'm in. And we brought you on these tables, we put you into the mirror image position, and we adjusted you, right? And the reason we put you in the mirror image position is because we're stimulating nerve endings that are going to create new pathways into the brain so that the brain can help to control the alignment and position of the spine by changing the muscular contraction rate to bring us back to where we should be. So the adjustment itself is a tool to help us to reduce that subluxation. After we gave you your first adjustment, then we told you we want you to use ice, right? And for some of you, ice is very unfamiliar. Most of you prefer the moist heat. It feels good. I mean, in July, and it's good to have the ice, right? In January, you really would like to have the heat versus the ice, right? But I have to help you to understand that ice is the modality we want you to turn to the very, very most because it will help you to heal more effectively. Right, so we gave you a handout, and this is your reference guide. You're going to take this home tonight. And this says, do you have one, John? Okay, good. This says how to rest with ice. That's the first page. Ice is a little bit tricky, and the reason it is because if we use it for too long, it's like using heat. Now, Joe's a big guy, right? But if we brought Joe up here, and while we started this conversation, we had him hold a 20-pound bowling ball out like this, right? Now we're about, 14 minutes into our conversation. At some point, his muscles are going to start to do this, right? They're going to start to fatigue. And eventually, he's going to have to set the bowling ball down. So what happens when we put ice on is the vessels that take blood from our heart out into our body, the arteries, have a muscular lining. So when we put the ice on, they do this. They vasoconstrict. They close down and slow down the blood flow into the tissue. If we leave the ice on for too long, it's just like Joe with the bowling ball, it's going to vasodilate. The blood vessels are going to open up and blood's going to come pouring into the tissue and we're going to increase inflammation. So what we're doing with ice is trying to control inflammation. We're trying to get the nerves to be less irritated, so the ice will help us to get there. You know, they did research study with mice, and they caused contusion injuries, bruises to the thigh muscles of mice. They divided them into three groups, one where they did nothing, one where they used heat, and the other group they used ice on. And what they found was the group that used heat, it took them 15 weeks longer to heal. So we don't want to slow and retard this process of recovery. We want you to heal more quickly. So ice is the key. You can't leave it on for too long. On the small body parts, 10 to 15 minutes. On the big body parts, 15 to 20 minutes. No longer than that. And please don't fall asleep on your ice pack. Throw it out on the floor. Go to sleep. It's fine. But don't fall asleep on it, because it's just going to be like using heat, and you're going to feel worse. So after that, after we've trained you how to use ice, we started teaching you some exercises. Now, some of you are a little bit further in this pathway than others. Some of you have just begun. Some of you have been here a couple weeks and you have most of these exercises. But eventually what we're going to do is teach you the exercises that are in this pamphlet, in this handout. The first exercise we teach everybody is neck extension. I don't care whether your big toe hurts or you got a headache. We're teaching neck extension. The reason is neck extension is the most powerful tool that I can ever give you. It makes the greatest change in the function of your body by changing the arc of that neck. Reestablishing that curvature as much as humanly possible will make the greatest difference. And here's why. Because in the neck, the spinal cord is the largest. As the spinal cord comes down through our spine and in, by the time it gets to about right here, there's strings of nerves now. It's not a thick piece of tissue anymore. It's very thin. So up here, compression of those nerve tracts. Where do those nerves go? Everywhere. So compression of those nerve tracts up there can cause any kind of dysfunction in our body. So neck extension is the most important exercise I can teach you. And how many of you love to do neck extension? Well, that's like the greatest thing. There's one of you who loves neck extension. Good for you. So laying back over the edge of the bed, starting is a challenge, isn't it? Man, it's such an awkward feeling for us to get that skull back into that position. And we teach you, now you haven't learned yet, Kathleen, but we'll teach you. When you lay back in that extended position, we tell you, you're going to do this for a minute to start, right? Some of you are like, I can't do this for 10 seconds. Are you kidding me? How am I going to do this for a minute? And then we tell you, well, you're really going to do it for 10. You're going to work up to do 10 minutes. And you're like, oh, hell no, I can't do it. Yes, you can. You can do it. You can make it happen. You know, you wouldn't expect to go into the gym for the first time and lay down on the bench and bench press 300 pounds. You wouldn't even consider that being an idea. You'd start with maybe the bar, and then you gradually add weight until you could do the weight, right? This is the same thing with neck extension. You're going to start at a minute. You're gradually going to work up to that 10 minutes. Now, some of you can get to 10 minutes in a matter of 10 days, because every day you're adding a minute. Some of you, it may take you 3 months to get up to 10 minutes. It's okay. However long it takes you, you just keep working, keep chipping away at that stone, keep working to get that neck and that head back, because it will make the greatest difference for you. After you're capable of doing neck extension over the edge of the bed for 10 minutes twice a day for 7 to 14 days, you can do that consecutively, we're going to move you up to the next level of neck extension, which is using this thing right here. Now, it looks like a medieval torture device. It is not. It's just a lead ball, right? And that's a harness, right? So now you need to picture I'm upside down, right? I'm hanging over the edge of my bed, and I put this thing on me, right? Just like this, right? I'm in extension, I'm back, and all this thing does is increase the gravitational pull on my skull. Makes my head heavier, right? That's 3 pounds. There's a 5 pound, there's a 7 pound ball. Most people never go beyond this. It's 3 pounds, right? So guess what? When you start neck extension with weight, you're going back to 1 minute. You're never going to do that for 10 minutes when you start. And then you're gradually going to work up to 10 minutes twice a day, 3 pounds of weight, right? I had a guy who's a football player, right? And his neck was like both of my thighs put together. And we used 10 pounds with him. But it's really, really, really rare to go beyond 3 pounds of weight. So this is what's going to produce the change. These ligaments, these muscles, these tendons, these soft tissues that are around your neck are very, very tough, especially the ligaments themselves. They take a lot of force to get to train that curve back into position. The blessing is we can actually do that, because that's what makes the greatest difference. So after you've been trained on neck extension, Then we start to work on the different type of exercises that are available for you. And you have all the exercises we're going to teach you in here. Some of them are very passive, some of them are more active. But so let's say you had neck problems, we'll start with the neck exercises, ranges of motion, cervical ranges of motion, standing neck retraction, reverse shoulder rolls, those kinds of things. If you have lower back challenges, we'll start with the stretch on all fours, the crossover with the rock, the piriformis muscle stretches. We'll teach you all of those exercises here, okay? But on the back, and please don't start doing these until we train you how to do them, okay? There's times that we want to implement these. Eventually you're going to do all of them. But when we look at the last 2 pages, if you open to the last 2 pages, the prone extensions and the abdominal crunches, these are strengthening exercises. So your care is going to start very passively, and then we're going to start to work to more active forms of care. So eventually you'll start working on strengthening exercises, and then at some point you guys are going to work on this thing right here. This is a Swiss ball. How many of you have seen these before? Most people have seen them nowadays. How many of you have worked on them before? Okay. So for some of you guys, this might be putting the polish on about how you do this the most effective way to do it. And for some of you, we might not even do this with you. You might not be capable of getting on the ball. It may be too challenging for you to do. So we may not address this at all. But this tool is such an amazing tool. And you know why it's so amazing? In the early 80s in Switzerland, they were getting great results with rehabilitation. People were getting better faster. And the reason was they were using this tool. Now there's a reason that this works, right? So let's say that I want to work on my abdominal musculature. I'm going to get on the ball. I'm going to get into the crunch position like I'm going to do a crunch, right? So by doing the crunch, I'm working the abdominal muscles, right? But what's happening with the rest of my muscles? They're working, aren't they? And the reason they're working is so I don't have to do this. Go flying off the ball, right? So this does something called neuromuscular reintegration. It gets the brain and the nervous system and all the muscles working together all at the same time. That's why we develop strength so much more quickly on this thing than we would on a flat platform doing some type of exercise. So this tool is really fantastic at helping us. We can stretch our body on it. We can strengthen our body on it. Now, one of the challenges I see with people when they come here is they say, I don't have really good balance, and I'm afraid I'm going to fall off the ball. This will develop balance for you, believe it or not. It helps to stimulate the nerve endings that tell the brain where our body is in space, and it's really, really a powerful tool. So you'll be taught this during the back power class. Back power is a 45-minute class. It starts at 6 o'clock on Thursday evenings. It runs till 7:15. It's taught over 4 Thursdays in a row. So 4 consecutive Thursdays of education. By the last Thursday, you'll have the ball. We don't use these blue ones anymore. We have yellow ones. So you have a ball, you have the manual of the exercises, you're going to have the knowledge about how to use this tool. And it is a really fantastic tool. And also the last class of Back Power, Class 4, is a review class. So let's say you take the Back Power course and you start to use these exercises, and then you're like, I don't really remember exactly how to do that. You can always come to Class 4 again. You can come to Class 4 as many times as you want to as a review, just to remind you to make sure you're doing it right. And there's no cost for you to come back to that last class again and again and again. So I hope that you'll stay engaged in this process. The blessing of the work that we do is people get better, and they stay better as they continue to work through this process of rehabilitation and correction of their spine. And I've practiced the other type of chiropractic, by the way. I think the first 7 years of my practice were pain relief focused. It's really no different than this. It's really no different than prescribing a drug to reduce pain. I mean, I'd much rather you have an adjustment to reduce the pain than you take a drug, because there's no side effects to an adjustment. There's really no known side effects to an adjustment. There's a plethora of side effects to medication. So if we can do this more naturally, that's great. But it never really produced results for people. So we're about producing results here. So rehabilitative corrective type of care that we do here is really going to help you to get there. And those examples that you see on the feature film board over there are people that you're sitting here with, that you're working alongside, who are making change in their spine. And that's the key, is to make that spine change, help that spine to change, right? So I want to share a story with you as we end here. Early on in my practice, I guess might have been my second it's probably my second year of practice. My oldest brother was a chiropractor, so I became a chiropractor because of his influence. And the first year or two of my practice life, I practiced with him. it's hard to work with family. So in that time period, we had a patient that came to us, and I'm from Pittsburgh, right? And have you been in Pittsburgh? Ever been in winters in Pittsburgh? It's a lot worse than winters in Philadelphia. Anyway, we had this patient who was referred to us, and some of you may have heard this story, so bear with me if you heard it already, but it made such an impact on me, and I hope it will touch your heart as well. This girl was 26 years old, and she was a assistant manager of a Burger King, and they were in their lunch hour, and very abundant time for them, and the ventilation system fails, right? So her boss says to her, you got to go up on the roof, right? Now, come on, a 26-year-old girl knows nothing about ventilation system. She goes up on the roof, right? Because her boss told her to do it. So she's running across the roof. Now, look, Lisa was a very large woman. And as she's running, she hits a patch of ice. And she goes upside down, completely upside down. Feet up in the air, head down. And when she lands, her head goes this way, and her right shoulder goes that way. And she lost complete use of her arm. All feeling, complete function was gone instantaneously. So by the time she had come to our practice, it had been probably more than a year. I can't remember the exact time, but it was more than a year after the injury. And she had been everywhere, man. To the neurosurgeon, to the orthopedist, to the physical therapist, to the occupational therapist. And Lisa had to learn how to do everything all over again because she was right in. So she had to learn how to write and feed herself, and how do you get dressed when you only have one arm, and how do you do all this stuff at 26? And the doctors had told her, you're done. It's never coming back. You're going to have to learn to live with it. This is the way it's going to be for you. That's a hard pill to swallow at 26 years of age. So she gets referred to us by one of our patients. And I guess, Lisa, I think she even said to me, what the heck do I have to lose? I don't have anything to lose, I only have something to gain, And man, we adjusted and adjusted and adjusted her. I can't even count how many adjustments she had. Many, 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 many. And no change, no change, no change, no change. Symptomatically, there was no change. Functionally, there was no change. On our checks, we're seeing change, right? Muscle tone's getting better, range of motion is improving, those kinds of things are improving. But symptomatically, she's getting no change, And at that time, we had closed rooms. It wasn't like this. So we would go in, and to watch her get on the table was quite a feat, man, because she had to strap this arm down and hold it down, and had to lay on it because it, was completely dead to her, And so I adjusted her one day, and I noticed the back of her muscle, the trapezius muscle in the back, started twitching. I thought, wow, that's interesting. I didn't say anything to her. And that kept up. Every time I would adjust her, it would get more and more and more. One day, it just pulled the arm out from under her body and flopped it down on the side of the table. So, I'm encouraged at this point. We're getting somewhere. We're making some change, And one day I walked in the room, and she's sitting up instead of laying down. And, we had instructed our assistants, to get you guys out, just like we do here. Get out of gravity, relax your body, prepare for the adjustment, And she's sitting up, and that's like, uh-oh, what's that mean, And I look at her and said, are you all right? And the tears start rolling down her face. She said, I moved my fingers today. Wow. So I'll tell you, there's greater healing power in you than you can ever imagine. And all the no's in the world doesn't mean that it's a no. And if you're willing to work beyond the establishment that tells you it only can be this way, there's great blessing for you. There's great hope. I'd love to tell you that Lisa got 100% use of her arm back. She didn't. She got about 60% function back, though. For somebody who was told they're never going to have that function back again, they're never going to use that arm again, that meant the world to her. And it has impacted me some 20-some years later. I'm still telling the story because the miracle of the human body is so incredible. You are so amazing in what you have inside of you. And chiropractic is nothing more than a vehicle to reduce subluxation. Subluxations interfere with your innate potential of what you can be as a human being. So Lisa got to us because somebody else told her the story. I'm asking you to do that same thing for people. I can't reach all these people out here. I don't have the megaphone of the TV shows and the newspapers. And everywhere you look, pharmaceutical companies have an ability to reach you with a message. And they spend billions and billions and billions of dollars a year telling you a story that if you're told enough times you believe is to be true. Ask your doctor for this. Tell your doctor about that. Put this in your body, it's going to make you healthy. Healing for Lisa didn't come from outside in. Healing for you does not come from outside in. It comes from inside out through this mechanism right here. As much as we can get your central nervous system to improve its function is the greatest reflection of health you're going to have in your lifetime. So on the back sheet, you have an opportunity to share the story of chiropractic with somebody. It's urgent, guys. It's absolutely urgent. People are told out there